This is Dr. Robert Frankel. I'm an emergency medicine and anti-aging physician, and welcome to the Modern Man Podcast. In this podcast, we talk about important topics for men, which include male aesthetics, health, and wellness. But most importantly, we try to remove the stigma of male aesthetics because I think that it's important to understand what men can do for aesthetics and how important it is for their social and psychological well-being, and ultimately just to feel and look good. So take the journey with me. It's going to be okay. It's going to be fun, so enjoy it. I think the next episode will be really interesting and informative, so take a listen. Hope you enjoy it. Again, this is Dr. Rob Frankel, and enjoy the episode. Thank you. So this is part 2 of the Modern Man Podcast of Save the Mullet, where we're going to look at the interesting, exciting treatments for hair restoration. So I think this is going to be the more interesting and exciting part of the podcast. What do you think, Zoe?
I think so too. This is going to be amazing because last episode you got to hear how hair loss happens, but this episode you get to hear how to fix hair loss.
Yes, and I think that this is going to be a really informative episode. I'm looking forward to getting into the information and the research and all kind of what really we found works and what are the downsides to some of the treatments, because I think that is really kind of the most important thing that people want to know.
Yeah, what treatments work, which ones don't, and that's always a big debate online and in doctor's office, so let's get into it.
Absolutely, let's do it. So the first thing we're going to need to do is we're going to have to go into something that might be heading into a little bit into the weeds, but we're going to try to do it as quickly and painlessly as possible. We're going to need to go into the hair cycle.
All right.
Because of the fact that the only way we're really going to understand how these treatments work and how the whole idea behind the treatments is to understand a little bit about the hair cycle. Now, we're not going to go into, the specific, mechanisms, the biological mechanisms behind it, but we're going to get just a brief overview of the hair cycle, so that way we can kind of get an idea of what's the really point of this and how does it really work.
And after this episode, I'm going to be able to add a science degree to my writing degree.
I think so. So the first thing is that, the first phase, I guess the most important phase that we like to talk about is the anagen phase. And so this is rapid hair growth. This is the phase that we all want to be in. This is the phase that we're trying to achieve, because this is the phase where hair is growing. And so this is the phase that we are looking to achieve. Okay? So in this phase, there's a couple things around the hair follicles that we need to understand. There's something called the dermal papillae. Say that a few times fast.
Dermal papillae?
Yes.
Okay, I'll do it once.
Okay. And then there's also a bunch of germ and stem cells around the hair follicle as well that sit around it, that are also there to kind of protect the follicle and also be there to be present and be there to nourish the follicle. And there's also a receptor that's there as well that I'm going to mention. It's called 5-alpha reductase. And I want you to be aware that this exists because of the fact that we're going to mention it at some other point when we get to it. So we have some of the background material when we talk about hair follicles. The other phase that we're going to talk about is the telogen phase. Before I get to the telogen phase, I'm going to go back to the catagenic phase. So the catagenic phase is actually when there is loss of hair, or the hair follicles are losing, or we're losing hair. The follicles are leaving the shaft. And so when this happens, the dermal papillae is actually being lost from the follicle. So there is an actual decoupling of the follicle and the dermal papillae.
So that would be something like trauma or damage that we talked about last episode.
That would be one reason it would happen for sure. Yes, absolutely.
And that's in the catagen?
So the catagen phase, correct.
Okay.
Yes. So the catagen phase is when we're moving from the phase where we have rapid hair growth to a phase where we're losing hair. Now, we want the anagen phase to be the phase that we're in most of the time, but there's times where the catagen phase is going to be a longer phase where we're actually losing hair. And so we think about the fact that the dermal papillae is lost at that point where the two are not close to each other. Now, the next phase that I'm going to talk about is the telegenic phase. The telegenic phase is the phase where we're in rest, meaning like nothing's really happening. And this is a pretty long phase where the hair follicle we often talk about is dormant, right? We often talk about that nothing's really happening, the hair's not growing, the hair is not losing, nothing's really happening, and often in this phase, there's nothing really kind of growing, but there's nothing really being lost as well. And
how much time is between, or how long is each phase?
So it's an excellent question, and the answer really is, depending upon what's going on with the person, it's variable. Now,
so with like your health, your stress levels, your environment, those will determine how long each phase is, and then what phase you're in.
Correct.
All right.
And that's the point. And we want to be obviously more in the rapid growth phase, the anagen phase, but a lot of people, stay stuck in this telegenic phase, or they get into this catagenic phase where they're actually actively losing hair. And so that's when we talked about the telegenic effluvium, the patients, when they're very stressed, they're actively moving from the anagenic phase into that catagenic phase, and they're quickly losing hair, and that's a real problem.
Oh, that doesn't sound good.
No, that's not good at all. And so we think about like what's happening when we're in the dormant phase or the telegenic phase and getting into the anagenic phase. The major thing that happens is the dermal papillae needs to kind of connect with the follicle, and that essentially creates a trigger. And so that's the trigger, essentially. And so you think about it as like what causes this to occur. And so there has to be something that triggers that phase to start. And so you could think about it, make it simple for yourself, and think about it that there's something that triggers that phase to occur. And so that's really kind of what we want to achieve. Like, we want to cause something to create dormant cells to get into the anagenic or the growth phase.
All right, okay.
So,
I got that science down.
Perfect. And so what we want to avoid is the anagenic phase from going into the catagenic phase, right? So that's the other trigger that we want to avoid, and that's when the dermal papillae is completely goes away or disengages from the follicle. And so the other mechanism that we want to try to avoid is we want to stay away from the anagenic phase going into the catagenic phase, which is rapid hair loss going into rapid hair growth going into rapid hair loss.
Okay, we don't want that.
We definitely do not want that.
So then what are treatments? How do we work with this in all these different phases?
So that's exactly what we're going to talk about. And so now that we have the whole picture of the hair growth, and we did it in a pretty efficient way, I'd say. We have the picture. Now we can talk about it in an educated way and how each one of these treatments actually work to prevent these different cycles or gain the create the goal that we want to reach. So the first thing that we talk about is that we must make sure that there's not a specific diagnosis with hair loss that we're missing. Because of the fact that sometimes there is a medical reason why people are losing their hair that has nothing to do with these phases of hair loss.
So it's something that is a skin condition or any other medication that you're taking, those would be symptoms, or those would be the options that you're talking about, that as opposed to hair trauma or damage to the hair follicle.
Correct.
Okay.
So that would be exactly, or, because of the fact that sometimes there's hormonal reasons why, people are losing their hair, and sometimes fixing their hormones will actually, repair, their cycle and create and stop the loss of hair as well. But yes, definitely what you're saying is skin conditions. There's certain types of fungal conditions that are out there that can cause, a loss of, patches of hair that will have nothing to do with any of these things that we're going to talk about. So anything that you do, that any of these treatments will have no effect on those types of causes of hair loss. So we have to make sure that we distinguish those. And so that's why it's important that when we, evaluate each person, you have to evaluate the person for these types of problems before we even discuss, like, is this person a good candidate for helping them? Now, sometimes it's an easier fix because of the fact that you can help them by treating their specific medical condition.
So not one size fits all.
That's absolutely true.
All right.
So now we're going to talk about each different, some of the most common and some of the more cutting edge things that you might not have even heard about, treatments for hair loss. Then some of the ones that you might have heard of with certain tweaks that you might not know about that might even make it even better. So let's talk about these things.
This is exciting. Let's do it.
All right. So the first thing that I'm sure that many of you heard of, because it's all over the TV, is Mindoxil, which is the common drug name is Rogaine. Right?
Oh, wait, Rogaine, right?
Rogaine, whatever you want to call it.
Depends what part of the country you're in, how you pronounce it, how your accent is.
That's correct. So, I think in Queens we call it Rogaine, or in the Midwest, I don't know how you call it, but we'll figure it out at some point. But yes, so Mindoxil actually was a blood pressure medicine.
Really?
Yeah.
Okay.
So the original, and it still is actually a blood pressure medicine. It never changed. It actually still people use it for blood pressure. But what they found is that when people were taking it for blood pressure, they were growing hair, sometimes in places that they wanted to grow hair, and sometimes in places they did not want to grow hair.
Whoa.
Exactly. So when they realized that, well, the good people at I don't know who actually makes
Rogaine,
Mindoxil, yeah. But I don't know, I forgot which company makes it, but they said, well, hey, this is a winner for us. Just like when Allergan realized that, hey, this headache injection actually makes people's wrinkles go away. Let's use it for that instead of headaches, because that's going to be much more profitable for us. And
that's how Botox was created?
That's right.
How is a headache and a migraine treatment first?
That's correct.
Oh, I didn't know that.
Yes.
Well, there you go. There's add that to the list of things I can do to build up my science degree.
That's right. The history of Botox was that it was FDA approved for headaches and had nothing to do with wrinkles. But
interesting.
But all of a sudden, those headaches, the people were having less head pain and they were having less wrinkles too. And
they looked younger. Sounds good to me.
And all of a sudden, next thing you know. So yes, and so minoxidil does work by helping the telegenic phase be triggered into the anagenic phase. So it does help by producing the follicles to move into hair growth. And so you do see, buds of hair growing after you often use it topically. You can actually use it orally as well. There are preparations where you use it orally. The problem with it using orally, it's harder to control. And again, like they did it, they realized early on is that you can grow hair in other places other than your scalp when you take it orally. So, by just putting it on your scalp, it's going to affect your scalp mostly, and that's where the method of action is going to be present. So was a good thing. Minoxidil, I think we mentioned earlier in the first podcast, has about a 40% effective rate. So, when we talked about that the first week, and I told the producer that, her response was, "What?"
Just like that. That's just how producer Joanne goes. So, what?
Right.
What do you mean 40%?
Correct. So
that's crazy. They've been working at CVS, Target, every drugstore across the country, and it only has a 40% effective rate.
You have to understand that what that means is that for 40% of the people, it works 100% of the time. So that means that it doesn't work for 100% of the people, but for 40% of the people, it works really well.
Okay, so you mean if we give it to 100 people, it doesn't work 40%
of your head
for all 100 people. It works very well for 40% of those 100 people.
That's right.
Gotcha. Okay.
Right. So that's what you have to understand. So it's not like, oh my God, like 40% of my head is great, but the other 60% looks terrible. So no, but it works well for 40% of the people. But the efficacy is like less than half of the people. But what we found though is that if you can add certain other products and certain other reasons why people have problems with hair loss and even kind of decrease, how can we stop people going from the anagenic phase to the catagenic phase? How would we do that? And would that help the efficacy of the minoxidil? What do you think?
Is there something you can add, or are you making your own cocktail?
I think that we can. And I think that, if you actually kind of add to the idea behind that, minoxidil works really well at producing the rest or dormant follicles from going from dormancy to the anagenic phase, which is the hair producing stage. But how can we stop it from going from the hair producing phase to the hair losing phase? That would be even better, because that would make the efficacy work better. And so you can actually do things within the formula to actually do both. And so things like adding retin A, and retin A is vitamin A, which is really great for a lot of things, but it's really good for inflammation. And one of the reasons why we start having problems with hair loss is because of the fact that when the follicle becomes inflamed, it's going to start to produce, and just like damaged, it becomes damaged and it starts to go into the hair loss cycle. So going from the anagenic to the catagenic phase is because of the fact that it becomes inflamed or damaged. And so by stopping the inflammation by using things like alicylic acid and by using retin-A and even hydrocortisone, these are things that actually will prevent it going from anagenic phase into the catagenic phase, and it actually increase the efficacy of Mindoxil.
Oh, that's so interesting. So would you be using these topically as well, or do you take it orally?
I would say we'd use them topically, and I think that we can absolutely, make the efficacy. So, here at Simply.Aesthetics, we are working on formulas to increase the efficacy, because our approach always is to say that the best way to really do this, there's no silver bullet like we said before, but if you kind of use all the different approaches and you use all the different approaches and you try to increase each efficacy, you will be able to get the best results. So
that sounds great. So is that something we're gonna concoct here at Simply.Aesthetics to offer our patients in the future?
Well, we're not going to concoct it right here in this office, but yes, we have a friendly pharmacist who is helping us concoct it.
Shout out to pharmacist Ehab. He always is great to work with, comes in really clutch.
Yes. So pharmacist Ehab in Ann Arbor, Michigan, is really good, a good partner for us. He does help us with all our needs, and he is working day and night for us to listen to my rants about what I think is going to be the best way for us to help minoxidil become more efficient.
That's amazing. That's so exciting. I can't wait to see what you guys come up with.
Yeah. So that's the first kind of idea. So the second thing that we'll talk about is another medication that's been out there for a long time, and that's Propecia. Finasteride is the common name. Propecia is the kind of name that you've heard on the TV screens. And so what Propecia does is it blocks the receptor that you've heard, 5-alpha reductase. I talked about that earlier, and that's one of the receptors that is going to stop the production of two things. It's going to stop the production of DHT, which is dihydroxy testosterone, but it's also going to stop the production, the phase of, it's basically stopping the anagen phase going into the catagen phase, which is a good thing. So there's a couple of things about Propecia and finasteride. It's effective in the fact that it does decrease the phasing of going from the very active hair growth phase into the hair loss phase, which is great. The problem with Propecia, though, it does have some side effects, and so I need to talk about these.
So does it have side effects on men and women?
So first of all, Propecia does not work on women at all.
Oh, okay. So that's probably why I haven't heard this. This is not as in circulation that I'm aware of.
Correct.
Okay.
So finasteride Propecia is ineffective for women because the receptors are not. I'm not even sure that they are even present in women, but if they are, they're not a large part of how the hair cycling occurs in women. So
okay, so then what are the side effects for men?
So for men, they essentially are causing low T symptoms, which, if you've heard, our podcast before, we don't like low T symptoms.
And for those that you don't know what low T is, it's Dr. Frankel's referring to low testosterone.
That's correct. Yes.
Okay.
So it will affect your libido. It will cause breast tenderness. I mean, essentially, what it's doing is it's increasing the effect of estrogen on your body compared to your testosterone. So it's going to increase that. It's going to increase swelling, in your hands and feet, and it's also going to possibly cause, erectile dysfunction as well.
Oh, those are not things that I want to tell a patient when recommending this treatment. I know a lot of guys that would say, you know what, never mind, I'll deal with my hair loss, but I don't want to deal with all those other symptoms.
That's correct. So, I mean, there are definitely lots of doctors who recommend this and actually prescribe it. We are not one of them.
No, we are not.
But like I said, it is effective for the reason why it does stop the hair growth phase from going into the hair loss phase. However, with the side effects that are present, I just feel like it's not going to be the best course of action.
No, that doesn't sound like an option route that I would want to take.
Now, for women, since we are going to talk about women with hair loss as well.
Happens to all of us.
Absolutely. So with women, one of the reasons why women do lose hair is because of actually they produce too much testosterone. You hear about the fact that you can grow hair in certain areas on your face because of high testosterone, but they also can lose hair on their scalp because of high testosterone as well. And so this can occur because of the fact that there's a condition out there that's called polycystic ovarian syndrome.
So PCOS, I know a lot of women with that condition.
Now, you could have PCOS without having any ovarian cysts.
Correct.
Even though it's called polycystic ovarian syndrome. It sounds like a misnomer because of the fact that it's called polycystic ovarian syndrome. But
you can have the other symptoms without having cysts in your ovaries?
Right, correct.
Okay.
So the major thing is the hormonal changes. And one of the major hormonal changes is that you will have elevated testosterone levels.
Women do not like that.
Right. So one of the major problems with that is that it can cause hair loss. So one of the major treatments that some women are put on is something called spironolactone. Now, spironolactone is a diuretic. It's a blood pressure medicine, and a diuretic for heart failure actually is used very commonly. But it also does lower testosterone. So it does have the effect of lowering testosterone, but it also has the effect that if you're not a heart failure patient and you're not a patient who has high blood pressure, you're going to have all the effects of this medication without having this problem. It also raises your potassium as well. So there's a lot of electrolyte potential imbalances that occur with spironolactone, with the ultimate effect of lowering your testosterone. So it really kind of is like a basket half full, basket half empty type of situation because of the fact that it really does have some negative effects. But
it still doesn't sound good to me.
Yes. Look up. So It's, it is what it is, but it's not the best. You could take something like saw palmetto, which has less side effects, and that also low testosterone. But these are hard problems to deal with. But saw palmetto actually is, and I've had patients who've had high testosterone that have some real success with giving them saw palmetto, which is much less toxic for them. So I think that would be a good option as well.
Okay.
So I'm going to talk a little bit about the next few, which we're going to get into some more interesting treatments. Biotin is B7, which is a very common thing that you hear about.
Absolutely. Women love taking biotin gummies and supplements for hair and nail growth. I know I'm really rigid about my biotin supplement intake.
Yeah. So the interesting thing about biotin is that the studies for biotin are very kind of small, and there's not a ton of research about biotin.
Oh no, he's about to debunk my routine in the morning. All right, go for it.
Sorry. No, I mean, it is true that what the major research that was done was that kids who were on seizure medicine that got fully depleted in biotin, that was losing hair, when given biotin back, actually gained hair back, and so that was definitely true.
Okay.
So full deficiency of biotin will make you lose hair for sure, 100%. But it's hard to say that without full deficiency that biotin does much of anything, because there's been very little research done on biotin, without knowing that the person was deficient or not.
Oh, it could all be psychosomatic then.
It's possible. But again,
okay.
It's hard to really say because there's not a lot of research on vitamins in general. And there's a reason for that. Do you know the reason why?
No, I don't know why.
Because the pharmaceutical companies don't make any money on vitamins.
Oh, they can't, because you can get them naturally or supplements, and they're not creating them in a lab.
That's correct.
And being able to charge you hundreds or thousands of dollars for it. So no one's paying the money to do the research on it.
That's right.
Well, there you go.
So you learn something new every day. Right. So it's hard to really say. I mean, but there's no doubt that the kids that were deficient in biotin, because of the seizure medicines they were on, did lose hair. They gained their hair back when they were given biotin, and that's factual. Other than that, there hasn't been a lot of great studies that have shown that biotin has been incredibly effective for hair or nails. A lot of it has been more anecdotal, but I mean, we'll take it for what it is. And I think that biotin is, I think for the research that we have, it's worth taking. There's no negative effects. It's a water-soluble vitamin, so it's impossible to be toxic to your system.
So I can't OD on biotin.
That's correct.
All right, that's good to know.
So I would say that I'll give it a thumbs up, with an understanding that we don't have a ton of research on it.
Okay, but it's also not going to cause kidney failure in me, so
that's correct.
I'll keep taking it.
Perfect.
Just in case.
So I didn't completely debunk or destroy your biotin
obsession. Okay, great. I'll take it.
All right. Next, we're going to talk about some things that do have a lot of research. So the first thing we're going to talk about is low-level laser therapy. That's a mouthful, actually.
Low-level laser therapy.
Yes.
Okay.
So low-level laser therapy is interesting. I'm gonna show you for the people watching on YouTube what the device looks like. And so low-level laser therapy. I don't know if I could turn it.
The handpiece that we have, for those of you listening at home, Dr. Frankel is showing that it looks like a bicycle helmet.
A bicycle helmet. And so basically what they found is that they've done a lot of research on this, And so what is the whole point of low-level laser therapy? And so the idea behind it is that if you put a laser at a certain temperature, what is it, will it have a certain effect? And so Zoe, that whenever I find out about something, I have to know the full historical facts about it.
Yes, that's one of the best things about conversating with you, is that you have a well full of historical details, which as a history nerd, I appreciate it.
Right.
So what is the history behind low-level light laser?
So in the 1960s, a Hungarian physician was looking at different type of laser to be able to look at cancer treatments. And he was looking actually to see whether laser actually increases cancer or decreases cancer. And so he was actually putting these lasers on mice. Now, the thing about these mice was that they weren't losing or gaining cancer, but what they were doing is they were gaining hair on their back.
Oh, so these little mohawk-looking mice were just running around?
Yeah. They were, probably going to the playground and realizing that, hey, I got a lot of hair on my back.
Oh, they probably got made fun of. Aww.
So they, so of course, the idea now is that, so how did this whole idea come about? So what they found is that at a certain wavelength, and what the wavelength that we were going to find that is most common is 650 nanometers. There's a certain wavelength that if you put it on the scalp, and it can't be too hot, right? So we talked about when something's too hot, it could actually damage like the follicle.
Right, we don't want that.
And if it's not too hot, so if it's a certain temperature that's not too hot, it actually can cause the blood vessels to actually start to kind of grow. And so this is the whole idea behind the low-level laser light therapy. So at a certain temperature and a certain laser wavelength, you start getting what's called angiogenesis, which is you start producing blood vessels at this temperature. And so there actually has been, for patients who had telangiectatic effluvium, a lot of research with patients who had stress-related hair loss, and they found they had great results with these patients. They had an increase, so what they did was they put patients in a group with the low-level light laser and just a red light laser, just like the red light you see at Halloween, like people.
Oh, okay, so just a regular red light for the holidays.
So people are like, oh, I'm on a red light. I'm like, and they didn't realize that it was nothing.
Okay.
And the other patients actually had the laser. They found that the patients who had the laser had almost a 40 to 80% increase in hair growth compared to the people who were in the placebo group.
Oh, that sounds like better odds than Rogaine.
Absolutely. So, what they found is that, these people were really did really well with, with the low-level light laser, and they really did, they got some really good treatments, and they overall had some, excellent results. So, with giving, the laser, adding the laser to the overall treatment, which is, again, very easy, there's not a lot of downside to adding to the laser. Now, if you have active cancer or anything like that, that's a contraindication because we don't know what the effects would be. But other than that, there's really very little downside to doing the laser every other day. They found that doing the laser every other day, they're getting really good results with patients, doing the laser every other day, getting hair growth because of the fact that they're building these new blood vessels around that area, and they're getting hair growth.
So if you guys are watching on YouTube or listening on the podcast, this bicycle helmet looking device, we just put it over the head for a patient, and for 10 to 12 minutes, you said, every other day?
That's right.
and it's very non-invasive. It doesn't even touch your scalp, and it doesn't burn your skin, correct?
Right. Correct.
All right. See, that does not scare me. That's something I would definitely try for 10 to 12 minutes every other day. 100%.
Yeah, and it's not for Halloween. It's for every day.
That's great. So I think we should leave them on another cliffhanger, Dr. Frankel, and leave the magic treatment for next week.
Really?
I mean, this is really exciting, all the science that we're talking about today, and the hair growth cycles. I think leaving them off on a really high note with the laser red light therapy. But we still have one trick up our card, or one card up our sleeve that I think we should save till next week.
All right, because we do have, actually more than one treatment left, and those 2 treatments are the most cutting edge part of the whole thing. So yes.
So all right, I think we're gonna see you guys next week for part 3 on Save the Mullet.
Yeah. All right. Excellent. So, well, we appreciate your listenership, and we are almost, at it, but we definitely have the most exciting part coming up in part 3. So we're sorry to leave you on a cliffhanger, but we really need to, get to that most exciting part. But now you have a lot of information, and we're almost there. So hang on for one more week, and we will get it to you.
We take it very seriously here at Simply.Aesthetics. We really want to help you guys treating hair loss. So go into much detail as possible, and we'll get the next cutting edge treatments out to you guys next week.
So if you appreciated us, like and subscribe to this video, and we will see you next week.
Bye, guys.
Yeah.